Hello, this is Rico Cavella, and this is your Fearless Aging podcast, where on every episode, my guests and I, we strive to offer you proven tips and strategies that you can implement immediately to greatly improve your overall health and well-being, and so that you can avoid old age and live a much longer, healthier life and make a bigger positive difference in the world, in which we definitely need you to step up and do. We all need to do that. So we're here to inspire you and empower you to become your best self. And again, so you can make a bigger positive contribution in whatever way that you can. So before I introduce our episode today and our expert guest, if I have a question for you, if you're wondering how well you are aging, well, I have a solution for you. You can go to our main website, agelesslivinglifestyle.com, and take our aging quiz. And if you're not doing as well as you would like to, I offer a free coaching session, and we can talk about whatever health challenges you're having, and we'll get you going on the right track. So go to agelesslivinglifestyle.com. So the title of today's episode is I'm really interested in, because this is one that I don't really have a lot of knowledge about myself, so I'm going to learn a lot myself as well. So this is about bioidentical hormone replacement for menopause symptoms. So this is really an important topic. And our expert guest today is Dr. Kathleen Brown. She is a board-certified obstetrician and gynecologist. She has dedicated her career to women's health and spent much of her career educating physicians in training. Currently, Dr. Brown serves as site director and works as an obstetric.
That's a tongue twister, right?
Yeah, that's a tongue twister. Hospitalist for the OB Hospital Group at Chester County Hospital in West Chester, Pennsylvania, and as a physician at Winona.com, which offers bioidentical hormone replacement therapies online. So, Dr. Kathleen Brown, thanks so much for being here.
Thank you so much for having me.
Yes, my pleasure. So, as I said, yeah, this is something that I think that, as we were talking earlier, that it's a really important topic that affects so many women, and we need to get this information out there, because there are natural, healthy solutions for this. So this is going to be really good. So why don't we just start by talking a little bit, what you see is the current problem, and how widespread is it, and why it's something that we really need to address.
Yeah. So, I mean, to begin with, I think that the first part of our conversation is that, really we as a human race are living much longer nowadays than we did, than our ancestors did, our grandparents, our great-grandparents. Our lifespan is increasing. And as we're aging, there's so many changes that happen to our body, so many, physiologic changes. But in women, the biggest changes with aging really affect our hormones. So our ovaries, are the primary producer of estrogen, and estrogen is really the lifeblood of a woman's body.
Mm-hmm.
It really affects every tissue in our body. It helps to make skin supple and elastic. It helps to protect the heart, helps to protect against heart disease and, heart attack and even stroke. And so what happens is, as we age, those ovaries pretty much start dying when we start going through menopause. They stop the production of the body's own natural estrogen. And slowly this estrogen is just kind of weaned out of our system. And so women will start to get all kinds of symptoms, from hot flashes and night sweats, which are very common, but also they can get cognitive changes, start to experience what we we call it brain fog. So, problems with concentration, problems with focus. It can even cause mood instability, the loss of estrogen. And then also insomnia. So sleep is greatly affected. And so, we know that as we age, sleep is so very important. Sleep is so restorative. So with the hormone changes that women go through, there's all this cascade of hormone changes that really is putting them through hell, for lack of a better way to describe it.
Let me ask you, so the reason that women go through menopause, is that so just to end, so they are not fertile anymore, so they can't have it?
Yeah,
okay.
So it's really the end of that reproductive life.
Okay.
And so women, come into that reproductive life in the early teen years. They have their entire, teens, 20s, 30s. And then the 40s is when they start, the ovaries start ramping down the production of the estrogen. So in America, the average age for menopause for most women is between 51, 52. But women can start to have symptoms and start to experience this transition for up to 10 years before their ovaries finally quit the estrogen production. So we're talking about a decade of changes and hormone changes that can significantly affect lifestyle and quality of life.
Well, let me ask you, I have another question that just came to my mind.
Sure.
I think that, our bodies are designed to function actually perfectly, and so I think I talk about a little bit, earlier on, before we had this such stressful society and all these toxic chemicals in all this sort of things. I think probably women, when they went into menopause, I don't think that they probably didn't have all these problems that people are having. So can you talk about why now in our modern society, people, of course, they're living longer as well, but also, why is menopause such causing so many problems for them?
Yeah, I mean, I think the fundamental first thing is that women are living longer, so when the lifespan was 50, and if the average age of menopause was 51, 52 that we discovered now, a lot of women never really experienced it or didn't notice things. But when you think about things in the environment, plastics in particular, we know that heating plastics, microwaving plastics can release, the BPA that we all try to buy, like non-BPA. But also there's some components in plastic that are very hormone-like in nature, when they're, released from these things. And you got to think also too about, the food industry in the United States.
Yeah.
What do the farmers do? So they pump their cattle, their chickens, their cows full of hormones because they want to beef them up. They want them to get fatter so that they have more meat to sell. But you got to think about what kind of hormonal byproducts might be in that meat when we consume it. So I think that there are environmental factors, but this is menopause is a natural part of a woman's life. It's a natural transition, and not every woman really experiences it horrifically. You can have two women of the same age where maybe one woman has maybe minor symptoms that don't bother her so much, whereas another woman is significantly affected to the point where she really can't function because of her menopause symptoms. Just one person to the other, their experience of it can vary. But for a long time, this was something that women suffered from in silence. So it wasn't that it wasn't happening, but there really wasn't the focus on women's health and really improving quality of life because, nobody talked about it. Then, about 15 years ago, we had the Women's Health Initiative study, which was a big national study where they studied hormone replacement therapy. And they did some very dangerous things. The way they formed the study and the way they actually chose their patients to study, they weren't ideal candidates for taking hormones anyway, but basically they published their findings saying hormones are dangerous, hormones are scary, they can cause all these horrible health problems. So as a result, this pendulum swung, and all the doctors that were previously helping women that were suffering from symptoms suddenly stopped prescribing. And so all of a sudden, all these women were going through this change and dealing with all the symptoms without any kind of assistance when it was really affecting their quality of life. And so we saw an upswing in osteoporosis because estrogen also protects the bone health. So many things that have changed in the medical community. Still to this day, not enough doctors feel comfortable talking to women about their menopause symptoms or treating it, offering treatments for them. And that's why Winona exists, because there's too many both family doctors and obstetricians and gynecologists in our country that just frankly don't have the skill set, the experience, or the comfort with helping patients with hormone replacement when they need it.
But isn't there a difference? I mean, now, like natural bioidentical hormone replacement is different than the standard hormone replacement that some doctors were given, which can be dangerous. Isn't that right?
Yeah, the synthetic hormones. So one of the most popular ones, which a lot of people have heard of, is called Premarin.
Yeah,
it was one of the earliest hormone replacement products, and that's estrogen only. And then there's its another medication called Prempro, which is also estrogen and progesterone. But literally, when you look at the name Premarin, the drug company was not very creative when they created this name. So the Premarin is actually an abbreviation for pregnant mare's urine. So they were actually taking urine from pregnant horses and extracting the estrogen from the urine of these horses and then putting this into a supplement and giving it to women. So what happens though, when you give a human female a constellation of horse hormones, then it's much higher dose. They're not even, the hormones, some of them are not even biologically active in a human female body. So of course you're giving them hormones that are much higher dosage than what their body really needs. It's not the same as what their ovaries were producing on its own. So yeah, so the bioidentical really means, matching what the body was making on its own with a similar hormone that's the same as what your body was making from the ovaries, so that it's not it's not synthetic, and that it's not this from a lab, it's not from a pregnant horse, really, like the Premarin was.
So where does it come from? How do you make bioidentical hormones?
Well, so our hormones are derived from yams. And so, a lot of our patients are either vegetarian or vegan and are, concerned about not having animal byproducts in the supplements that they take. And so the hormones that we get, the estrogen that we use and the progesterone that we use are derived from yams.
From yams. Isn't that interesting how everything really that our body needs is somewhere in nature? Isn't that interesting?
It really is.
Yeah, how was that discovered? How did they discover that yams would have the bioidentical hormones for women?
Yeah, I don't know in who actually discovered that, but it's been kind of in knowledge that the yams produce, like, they have what we consider to be phytoestrogens. It's like natural plant estrogens. And so, it's just a matter of extracting it from the yam. Yeah.
Okay, so how safe is bioidentical hormone replacement?
Well, for appropriately screened patients, it's very safe. And we say appropriately screened because there are some health conditions that if women have, they can be at higher risk for having complications from taking hormones. So namely, like if a woman has had a history of a blood clot in the legs or the lung, what we consider to be a deep vein thrombosis, or DVT, or a PE, which is a pulmonary embolism. So if you've had a history of those, you're not a great candidate. If you've had heart disease or have had a heart attack or a stroke in the past, where you're at higher risk for having a clot event, then you might not be a good candidate for hormone replacement. But minus those conditions, most patients are actually very good candidates for hormone replacement. And typically we use the less is more model. And so we use the lowest dose that we need to really help a patient's symptoms for the shortest duration that they need. With any medication and anything in life, really, moderation is key. But especially when you're taking a medication that's, something you're giving to your body that's foreign, even though it is bioidentical and we're trying to match the hormone that your body is lacking, we try to do as low dose as possible just to help those symptoms and help women through this transition. Okay.
So what would you say are the most common symptoms that people should be aware of and realize that this is something that I should really get checked out and see if I need hormone replacement?
So I think that the most common symptoms are hot flashes. So typically the way a woman would experience that, you could be in a room with anybody else. There's no change in temperature. No one else really notices anything. And you can feel this sudden rush of warmth. All of a sudden just kind of come over, and really it focuses on the upper part of the body. Some women will actually get red in the face. Their skin will actually get flushed. And some women can actually experience like sweating when it happens too. Some women will also wake up in the middle of the night. They can't sleep through the night. They're waking up in a cold sweat. They're waking up hot. It's the traditional, you hear the story about a husband and wife laying in bed and the husband's shivering under the covers. The wife throws off the covers, suddenly wakes up again and it's cold, back and forth. It's this temperature fluctuation. Like the body is no longer able to maintain that sense of homeostasis and keeping, that thermal regulation of itself. And so as a result too, we also get, disruptions in sleep. So some women may have trouble falling asleep. They might have trouble staying asleep. Also, one of the other biggest symptoms that we notice when we're losing estrogen is vaginal dryness. So women will notice that they might lose lubrication from the vagina when they want to be sexually active. They might notice dryness, pain with sex also. And then also cognitive problems. You know, you might go in the other room and, you know, to do something, you get in the other room and you forget what you went in there for. You know, it's memory issues, what we consider to be brain fog, you know, just not being able to focus, not being able to stay on task. And there can be emotional lability too. So a higher risk of having symptoms of depression or anxiety, not being able to cope with stress as much can also relate to hormonal changes during menopause as well. But there's a really long list of symptoms. These are just the most common ones.
So do some women just pass through menopause without having any real symptoms that cause them a lot of problem or not?
Some women can, yeah.
Okay.
It's certainly possible. And, you know, and every woman's experience is different. So, you know, if you take 10 women in a room that are all the same age, you know, maybe half of them might have significant symptoms that they would seek treatment for. But the symptoms can be significant enough that it can really affect someone's quality of life. You know, imagine someone trying to work in business or industry and trying to, especially a woman like running a company, suddenly dealing with all these day-to-day changes that are going to affect productivity and focus. And, you know, it really can affect your relationships and personal relationships as well. So it's an important aspect of women's health.
What would you say the average age is when most women begin menopause?
51 to 52 is the average in America. Yeah.
So would you
like
recommend?
I said earlier, women can start to have symptoms for up to a decade before it actually stops, before their period stops.
So would you recommend then that most women, when they're getting close to that, and they're starting to have some of those symptoms, that they definitely should get themselves checked out?
Yeah.
Yeah.
Yeah. I mean, there's a lot of different ways to do that, but I think that really starting to take note of your symptoms. I always encourage my patients to really be aware of their body, you know, and really, you know, even doing a symptom journal, you know, you start to notice things, start to notice the hot flashes, you start to notice night sweats, you know, write it down. You know, we all have phones now, put it on your calendar, you know, when you're having symptoms, and don't be afraid to ask your provider about it.
It seems to me too that it seemed to me to be wise to consult with a woman physician on this problem as well, because you guys are a lot more tuned into it and understand it, right?
Especially if we're going through it as well, or have gone through it, you know, certainly, you know, for the aging female physicians, you know, we have a personal vested interest in this for sure.
That makes sense.
So, you know, when you start experiencing this on your own and you start to realize like, oh, this is, you know, so different than what you're reading and studying in textbooks when you're becoming a doctor. Like when you actually start experiencing it as a patient, you know, it gets very real. But, you know, there's some really wonderful male physicians that, you know, the more they educate themselves and the more they become well-versed in this, you know, that they can significantly help their patients as well, even though they're a male physician. I think that it's just about having a doctor who listens to you, you know, who takes you seriously. Because the problem is now with menopause in this country, if a woman goes and complains of these symptoms, they're told a lot of the times, well, this is just a normal part of aging. You just deal with it, you know, just suck it up, which isn't always the best answer, you know, because if it's distressing to them enough that they're bringing it to the attention of that person that they're hoping to care for them, then it warrants treatment if they want.
Yeah. Well, before we get into, I know you're one of the physicians at your online website where you guys can treat people online, which I think is really good, makes it really easy and simple for people. But aren't there some natural things people can do as well? I remember reading things like, you know, you should be taking like maybe magnesium and minerals, and maybe doing things like yoga and breathing and all those kind of things can be helpful as well.
Yeah, I mean, there really are a lot of things that people can do for themselves, for their self-care and for wellness. You know, one of the biggest things that I encourage patients to do is really the nutrition aspect of things. You know, and there's not enough education and knowledge for the average public on nutrition and the importance of it. You know, with the way that the food industry in America has lobbied to change everything, and you look at supermarkets and grocery stores, the majority of everything in that grocery store is horrible for you.
Yeah.
I tell my patients to stick around the perimeter of the grocery store. Everything that can go bad is the best thing that you should be eating.
Yeah, that's so true. Yeah, most of the real food is around the
Whole
perimeter.
foods, right? Things that aren't processed, anything that's processed so much that it's shelf stable for years is shelf stable in your body for years. It's not giving you the nutrition that you need. So one of the biggest things I notice in patients is that they don't get enough natural protein in their diet. They don't get enough fiber in their diet. And you're right, magnesium is an important supplement because it can help with brain health. Basically our cognition and the optimal functioning of our neurotransmitters. Magnesium has been used in a lot of other ways. We use it to prevent migraines in some patients as a preventative supplement. In obstetrics, we use it to help stabilize that blood-brain barrier in babies that are born premature. Also to protect women from seizures when they have this condition called preeclampsia, because it really helps to optimize the brain health. And really, if you eat a whole food diet and you eat lots of different colors of vegetables and fruits, you're probably getting a lot of good nutrition and supplements, but the average diet in America is not great. And so, adding some other supplements in can sometimes help, as well. But maintaining motion, like you mentioned yoga, it's so important, for anybody when they age, but especially for women, that they maintain motion of all their joints, that they do weight-bearing exercise, because that's what protects us against the breakdown of our bone health and our bone strength, because women are at much higher risk for things like osteopenia and osteoporosis compared to men. So movement is key, and staying active, maintaining mobility and flexibility are helpful too. And then other things too, like if a woman is experiencing a lot of hot flashes or night sweats, there are certain things that can exacerbate those, like alcohol in particular. Alcohol can make hot flashes worse, and because it's really a toxin you're putting in your body. And in moderation, everything's okay in moderation, but sometimes reducing that can help reduce the amount of hot flashes you have as well.
Really good, really great information. I just wanted to add, this is kind of funny, we're talking about the supermarket thing. I can remember, I think this is back in the 80s when when health food and stuff was just starting to come out and get more popular in health food stores. Right. I remember going into a mainstream supermarket. It was a Ralph's Market out here in the West Coast, and they had a little display in the center of the store that had a little table and some things were piled up there, and they had a big sign that said health food. And it just cracked me up. Oh, well, then what's the rest of this stuff?
Right.
It's unhealth food, but here we got a little health food for you. It just, I don't think they realized how funny that was. Oh, well, this is health food. Well, what's the rest of this stuff they're trying to sell us? That was so funny. That's so fun. So yeah, it's so important. I really like and agree with all the things you said. It's so important. Your nutrition is so important, and movement is so important for all aspects of your health. Well, that's so good. Such great information, Kathleen. Thank you. And so let's talk a little bit about you guys have an online website called Winona. It's winona.com, and we'll put that in the show descriptions where we can go there. So tell us about how people can just connect with you there and get some help.
So the website is bywinona.com. So BYWINONA.com.
Okay.
And really, this is an online platform where you can have a dedicated board certified OBGYN that can monitor your health and treat you for menopause with hormone replacement therapy. We have a pretty significant questionnaire that you'll go through. Like, we get your medical history, you'll go through some questions to make sure that you're a good candidate. The onboarding process is really to make sure that this is going to be a safe option for you, and that we're obviously making sure that the safety and quality for our patients is the best that it can be. And so the nice thing is, you don't have to worry about driving to your OBGYN office, getting the appointment, driving in traffic to get there, paying your copay for your insurance, and then talking to them and then trying to figure out if they're actually going to prescribe. So with this, you have an online visit. So basically you fill in all your information, you go through the onboarding process, and then depending on what state you're in, you'll have a doctor assigned to you that will then review all of your information. And we do mostly an asynchronous model, meaning that we do messaging between patient and doctor. And so our patients have access to their physician 24/7. Whenever they have a question, they can get in there and contact us. So typically we go through their medical history. We look at the symptom profile that they have that's affecting them. And we come up with a solution as far as treatment options to really help their symptoms. We have various different kinds of hormone replacement. We have most popular is our body cream. And it's a compounded estrogen and progesterone body cream that patients apply to the skin. And it gets absorbed through the skin and into the bloodstream to help with these symptoms. But we also have patch form and pill form of medication as well. And we also have a product that helps also with sexual satisfaction as well. So a lot of research has gone into men and erectile dysfunction, and not a lot of research has gone into really affecting a woman's sex life and satisfaction with that. And so we have a product called Blossom, which kind of works like a female Viagra. It's a substance they put on the clitoris to help increase blood flow to the area to help arousal and help with orgasm. So a lot of our patients like that a lot too. So that's another added service we offer for patients, that product. But it's nice because most of my patients, especially in Pennsylvania, have come to us because they just cannot find a doctor in and around where they live where they can get help from. A lot of them have gone with symptoms and kind of been dismissed by their physician just because they're told, oh, you don't need that. It's a normal part of aging, but then they're continuing to suffer. And so that's why Winona exists, is for patients that don't have the access to a provider who feels comfortable prescribing this.
Well, that's really good. Yeah. Well, yeah. Well, thank you guys for your great work. I know you're offering a really good service. And so I definitely recommend that you can get a consultation and go to buywinona.com and you'll get some really good help there. I have a question for you too. I have heard say that some people say that there actually is a form of male menopause too. What do you think about that? I mean,
Well,
we do.
I mean, certainly there's changes with aging with everyone, no matter what your gender. But with men, I mean, I can't speak as an expert, obviously, as I'm a gynecologist, so I don't take care of men.
Yeah.
But there is a decline in testosterone production. So,
Right.
When you look at men and women, estrogen is predominantly the female hormone, although women do have some testosterone as well.
Right.
But in men, it's this testosterone production that really affects their vitality.
Right.
And really the health of their body. And so there is a decline in that with aging as well.
Yeah. Very
So,
good.
yeah.
Well, Kathleen, that was excellent. Really great information. And again, I commend you guys for your service. You're offering a really great service. So do you have any last message for people who are wondering if this is something that they should check out?
Yeah, I think that if you're curious, you can certainly get onto our website. We have a lot of information. There are, information blog articles on our website. There's questionnaires. Like if you're not sure if you're really a good candidate for this type of therapy, there's some questions and you can go on our website and look through that. But really, the goal is that we want you to go through as you age. Like there's no reason why you should have to let your body disintegrate or defervesce, that we want to make the second half of our life just as good as the first. There's no reason why we have to go gently into this. We can maintain our vitality and our health with all these tools that we have available. And this just happens to be a great tool that can really significantly help women as estrogen replacement therapy.
Great. Well said. Great message. Yeah. Thank you. Thank you very much. So I always like to end all of my podcasts with saying, knowledge without action is useless. So we always give you some great information, some great knowledge, but you got to step up and take action on it. So you can do it, but just got to step up and take action. And if you like today's episode, please give us a good review and tell your friends about the Fearless Aging podcast. Thanks very much for being here.
Thanks so much for having me.
Yeah, thank you, Dr. Brown. That was excellent.
Yep.